The nurses, united, will never be defeated. The nurses, united.
Here at Townsville Hospital with Louise Middleton, a big event on today. What's happening?
Absolutely. We've got hundreds of nurses here across the district. They've come from Ingham, Charters Towers. Our Assistant Secretaries come from Brisbane, and we're giving a strong message to Q Health to leave nursing positions alone. The nurses that they're looking to cut are frontline. They won't give us a definition of frontline. Our community in Townsville is going to be affected, and that community extends up into the Gulf. It extends above the Cape and all the way to the Northern Territory border. So leave our nurses alone.
How's the announcement this morning that Campbell Newman's given the nurses a pay rise on the eve of this action?
I've never heard of that. I have not got that from our office. We're here to say, leave our positions alone. We don't want a pay rise from him today. We want to keep all our nurses in jobs.
How's this going to affect health services in the Townsville area?
It'll have an effect. It'll have a definite effect. We've got senior nurses in these fantastic positions that pull patients up from ED onto the wards, provide this amazing expertise of care, and they want to get rid of those positions. Well, bring it on, because we're here today to show you that we are determined and we're ready to fight. And you can hear that from behind me now, actually.
And Louise, this is just the beginning of action across the state.
Yep, we've got another rally next week in Townsville. We've got another rally the week after that, and all the unions are here to support us.
Well, Louise, good luck in the cause and on the nurses.
Yeah, thank you very much. Thank you.
Shame, Premier, shame. He has lied to us. He has lied to the workforce. He said there would be no redundancies with frontline staff. He said that they wouldn't. They signed an industrial agreement with the union, not just this union, but other unions that are in the process.
Big day here at Townsville Hospital. Lots of things happening. What's your involvement?
Well, I'm the president of the Queensland Council Unions, which represents all the affiliated unions throughout the state. So we're here to support the workers today and also the general community against the announced cutbacks to the hospital jobs. And what really alarms us, it's not just Townsville that's going to be impacted upon. It's all the regional areas around us. Townsville gives support for a lot of the regional centres, such as the Vertigan, Bowen, Charters Towers, Ingham, Ewan, Richmond. They are all going to suffer under the cutbacks to the staff, which means a reduction in services to the people of Queensland and regional Queensland.
Could this be possibly seen as a thin end of the wedge for the rest of the state?
Certainly. This is just the starting point for this government. They've made it quite clear they're going through. One moment it's 20,000 jobs, next minute it's 15,000 jobs. They don't even know themselves where the next cuts are going to be. And then when they get a bit of pressure from the general community, they want to blame the boards that they've appointed. At the end of the day, the boards report back to the government. So I'm sure if the government thought the boards were doing the wrong thing, they would be intervening. And they should, in this circumstances, do something about the announced approximately 200 jobs that they're going to cut out of the essential services with the health in Townsville.
At grassroots level, what's this going to do to waiting times at the Townsville Hospital?
Look, it's just going to make things worse. The Townsville Hospital has not got a good track record in terms of quality of service, and this isn't the way to address or improve on that.
How does the announcement that Campbell's giving the nurses all a pay rise today sit with this meeting today?
Look, I think he's trying to take a lot of the pressure away from the actual fact that he's actually reducing the number of services. At the end of the day, he can give the nurses and the support staff as much money as he likes. It's not going to help the workload and the stress loads that these people are going to carry, which is going to then flow on to the people in the community that needs the services they provide.
So the message going forward for the day to Campbell Newman, what's that?
Take note of what the people are saying. The last government refused to acknowledge that 85% of the people are against the sale of the assets. They went down the road of we're doing hard decisions for the people of Queensland. Look where they are today. And that's where Campbell Newman and the rest of his followers are heading if he doesn't start changing his attitude.
It sits there and employs high-paid barristers to sit in the commission yesterday afternoon for 3 hours, lying and misleading the commission about what workers had been told at this hospital when they knew full well that that was simply not true. And we will meet with the hospital management tomorrow and we will be having our discussions with them. What we have lost is the right for you to have control over your jobs. What we have lost is, for instance, in the nurse manager area, the right for them to control rosters, to have any financial accountability. It has all been taken away, and that will spread through this hospital like wildfire at the great detriment of the community and the patients that you look after every working day of your lives.